In recognition of National Sepsis Awareness Month, I present to you today the case of a septic patient on mechanical ventilation who did not waken after sedation had been discontinued. While sepsis is not considered to be a common risk factor for seizures, literature over the past decade has shown this to actually be the case. In a 2015 paper by Azibo, patients that presented septic, those that were delirious, 32% of those patients were found to have electrographic seizures. This is a 79-year-old female that originally presented with respiratory syncytial virus, eventually developed a secondary bacterial pneumonia, and required mechanical ventilation due to hypoxia and hypercapnia. The patient was weaned off sedation rather quickly due to her low RASS score, but by the next morning still had not woken. Nurse approached me and requested that we place point-of-care EEG, given our history of using the device in our institution. CT scan to evaluate for other possible pathology. Point-of-care EEG was placed, immediately going to 100% seizure burden within the first 5 minutes. Patient was subsequently given 4 milligrams of lorazepam, taking the seizure burden down to 0. I had texted neurology at that time as well. They got back to me an hour and a half later, confirming that that was non-convulsive status epilepticus, which had resolved with the medications administered. The neurologist subsequently sent over the long-term monitoring EEG tech, and we were able to transition this patient over. CT scan showed no other pathology, either laboratory otherwise was negative at this point as well. The overall impact of point-of-care EEG allowed us to diagnose the patient quickly, institute therapy quickly, see subsequent response to the therapy, and also triage finite resources within our institution.